So even before we came here, these babies hardly ever survived in the town. But here, thanks to all the team together, technology and methods and all things putting together, we are saving nearly 98 to 99% of these babies.
Over 67,000 babies are born in India every single day. That's 1/6 of the world's childbirths. And tragically, every minute one of these 67,000 newborns die. According to a 2018 Census of India report, the infant mortality rate in rural areas is 1.5 times more than that of urban areas. That's a stark difference in healthcare. Dr. Arvind Dahiya, whom I'm about to meet inside, is an intensive care specialist who set up a hospital here in the small town of Rohtak, around 100 kilometers from India's capital city, Delhi. Dr. Arvind.
Hi, man.
How are you? Let's do
I'm
a little
good.
bit of a
Welcome.
A little bit of a COVID handshake. So, Dr. Arvind, what were the infant mortality rates before you came here?
Outside metro cities, neonatal care was not well structured. So this is the first neonatal ICU of level 3 capability we have created in this town, which is serving a population of nearly 3 million. One part of infant mortality is called neonatal mortality, which is babies dying in first 28 days. Since we have started, the mortality we brought down to 2%. So that is the reduction from 70% mortality to 2% mortality now.
I'll follow you.
Normally it's a very busy time, but these days in COVID, numbers are down a bit. This baby is born today. He's a 33-week baby, significant difficulty in breathing. He could not sustain himself. So with the help of ventilator now, I think he would improve and eventually he would go home.
And if this neonatal ICU wasn't here,
Yeah.
what would be the options that the parents had?
They have no option for these kind of babies. This is the first of its kind facility in a 100-kilometer radius. It was not there before. They all had to go to Delhi or nearby metro town, and that is 2 hours away. There is no way they could have reached there.
What are the numbers that are coming through the door if you're the only place within 150 to 200 kilometers?
Well, nearly we admit around 400 to 500 babies of this kind, premature babies every year. And in 4 years, we've admitted around 1,200 babies. Out of that, only 2% died, which is phenomenal and is comparable to US data.
But this is a big hospital. What's the impact that the entire facility is having on the region?
Well, when we came here, this is a personal story. I lost few of my relatives because of lack of emergency and structured high quality care. So began in 2009, after lots of ups and downs, finally with the help of my dad, my brother, and my whole family, friends, we were able to build this facility. And since we are here, we have admitted nearly 5,000 patients in ICU. In our absence, out of that 5,000, nearly 4,000 would have died. Not only that, having this facility here inspired many other people to create state-of-art facility, and the whole region is now getting benefited in terms of trained human resource. We are training and they are going other places and uplifting the whole care in the region as well.
You had a fantastic life in the UK. What was it? Was there a moment where you decided to come back and make this happen?
Well, I was extremely happy in Britain. I loved my time there. But still, there was a back of mind. I always wanted to contribute toward the evolution of my specialty in India, that is critical care and emergency care. That was the biggest motivator. India is reasonably sorted in terms of secondary care, but given the emergency care is very patchy. And secondly, my parents were alone here. Me and my brother was in US, I was in UK. So in the old age, they probably need us. That's why we came back.
The parents, do they ever bring the child back when the child is old enough to know what happened to meet you?
The most beautiful thing about neonatal ICU is they come with a baby, a limb baby, and after a few months and a few years, you see them running around you. It's incredible, biggest motivator to work. But that's what makes us keep going.
Dr. Arvind, I've never been on a neonatal ICU before. What a brilliant insight into your world. Really appreciate you having me today.
Welcome, Mikey. You're always welcome.